Hypertension is another name for high blood pressure, and more than 100 million Americans have it. Today on Health Minute, presented by Hallmark Health, everything you need to know about hypertension. I'm here with Dr. Davis Boo from Internal Medicine at the Melrose Wakefield Medical Building in Wakefield, a beautiful new facility here.
Yes,
we're going to talk about hypertension. It is pretty common in the U.S. What is it exactly?
So hypertension is high blood pressure, and the analogy that I like to use is the water in your pipes in your home. And so the pipes deliver water just like the arteries deliver blood throughout your body, and they're designed to have a certain pressure. But if the pressure is too high, in your house, you still get water to wash your dishes, to wash your clothes, and you might not know that anything's wrong until one of the pipes bursts and you have a flooded basement. And so similarly with high blood pressure, when the pressure goes too high, you might not have any symptoms, but over time, the high pressure damages the arteries in your body, and then that can lead to a heart attack or a stroke or something bad happening.
Okay. Are there certain people that are at risk for this, or can anybody get it?
Well, so a lot of it might be sort of age, and genetics are probably two of the biggest risk factors, and there's not a whole lot you can do about either of those. But some of the other risk factors include being overweight, having a high salt diet, drinking too much alcohol, and not getting enough exercise. And so those are some of the things that you can do something about that's going to increase your risk of having a high blood pressure.
Okay. And what are some of the signs and symptoms that make people think, oh, something's wrong, I might have high blood pressure?
Yeah, so high blood pressure used to be called the silent killer because oftentimes you don't have symptoms. And sometimes people will get a little bit of a headache or something, but most of the time they don't know it. In fact, under the previous guidelines, and the guidelines have changed, but something about like 12 million people probably had high blood pressure and didn't even know it. And so it's important that people are aware and get checked out.
Okay. Let's talk about that. You said there's some new guidelines. What are they exactly?
The biggest change is probably the definition of high blood pressure. And so we used to call high blood pressure, hypertension, 140 over 90. So the numbers that your doctors gives you is over 140 to 90, you have high blood pressure. Now it's been reduced to 130 over 80. A lot of those new, the patients who fall under the new guidelines are probably patients in like the 20 to 40-year-old range. And so they probably have never been told that they had high blood pressure. They're probably unaware. And so when they come into the doctor's office, it might be a little bit of an awakening.
For someone who comes in and gets high blood pressure, what are some of the treatment options for them? Are you looking at medication right away? Or are you looking at dietary changes?
So the cornerstone of any therapy, and this is also true with diabetes, with high cholesterol, is lifestyle changes. Again, think about diet and exercise. With diet, there's something called the DASH diet. You can go online and look it up. It's the American Heart Association has great resources there. And low salt diet, exercise, losing weight, you can also reduce it by like around 5 points each. Alcohol, also a couple points. If you can't get it controlled with just simple lifestyle changes, then there are a number of medicines to choose from. And it's mostly the conversation that you'll have with your doctor in terms of what the right medicine, in terms of lowering your blood pressure and side effects.
Dr. Booth, thank you so much. This was terrific information, and I'm hoping everyone at home has learned something from today as well.
Thank you.
Thank you.